It's 11:47 at night, and your dog won't stop shaking his head. Not the quick after-a-bath shake. A hard, rhythmic, almost violent flick, over and over, followed by him dragging the side of his face across the carpet like he's trying to scrub something off from the inside. You lean in, and that's when the smell hits you first, sour and warm, before you even see the dark, waxy discharge pooling just inside the ear flap. He flinches when your fingers get close, ears pinned back, and you can feel your own heartbeat pick up, because this is clearly not just a little dirt. Your first instinct is to grab a cotton swab and go digging, the same way you'd clean your own ears without a second thought. What if that instinct, the one that feels like help, is actually the thing standing between your dog and permanent hearing loss? Hi everyone, I'm Dr. Ryan Scott, your neighborhood veterinarian, and ear problems like this one are one of the most common reasons dogs end up in my exam room, mostly because by the time owners bring them in, a simple, cheap problem has quietly become an expensive, painful one. Today we're doing a full masterclass on ear health, why dogs' ears are built to trap trouble in the first place, how to actually look inside one safely at home, the single mistake I see almost every week that turns a mild irritation into a ruptured eardrum, the safe 2-minute check you should be doing weekly, a tiered set of home care steps for mild cases, my personal favorite low-cost trick for keeping ears dry, and the exact red flags that mean it's time to stop everything and get to a vet. So stick around, and if this is useful, go ahead and subscribe, because we're covering a new home care topic like this every single week. Let's move to Chapter 1, the biology, because understanding the shape of your dog's ear canal explains almost everything else in this video. Unlike our ear canal, which runs in a short, fairly straight line to the eardrum, a dog's ear canal is shaped like an L. It drops vertically down from the visible opening, then makes a sharp turn and runs horizontally inward to the eardrum. Think of it like a drain pipe with an elbow joint in it. That bend is great for protecting the eardrum from outside debris, but it's terrible for drainage. Moisture, wax, and debris that get past the vertical section tend to pool right at that turn instead of running back out. Add in the fact that the skin lining that canal is packed with ceruminous and sebaceous glands producing wax and oil, and you've essentially built a warm, dark, humid pocket at the bottom of that L-bend. Bacteria and yeast that live on skin normally in small, harmless numbers find that environment ideal, and when moisture or excess wax tips the balance, they multiply rapidly, which is what triggers the itching, odor, and inflammation you're seeing. Chapter 2 is the home assessment, because before you treat anything, you need to know roughly what you're dealing with, and you can gather a surprising amount of real information without ever putting anything inside the ear canal. Gently lift the ear flap and look at the visible part of the canal opening in good light. Healthy ear tissue is pale pink, with maybe a light faint coating of tan wax and no strong odor. A yeasty overgrowth typically produces a thick, brownish, waxy discharge with a distinct musty or corn chip smell. Genuinely, veterinarians use that exact description because it's remarkably accurate. A bacterial infection more often produces a yellowish, sometimes bloody discharge with a sharper, sourer odor. And here's a myth worth correcting directly. A lot of owners assume that dark, coffee ground-looking debris always means ear mites. But in adult dogs, mites are actually a fairly uncommon cause of ear problems compared to yeast and bacterial overgrowth, which are far more common culprits behind that same dark discharge. So don't assume mites and start applying random over-the-counter mite treatments. What you're looking at is usually something else entirely, and the treatment is different. Now Chapter 3, and this is the most important part of the entire video. The dangerous mistake. It is the cotton swab, the Q-tip, and I understand the instinct completely. You see gunk, you want it gone, and a swab feels precise. But remember that L-shaped canal we just talked about. A cotton swab is essentially a straight, rigid stick being pushed into a canal that bends. Instead of removing debris, a swab most commonly just packs that wax and discharge further down into the horizontal canal, compacting it right against the eardrum, the one structure in that whole system you absolutely cannot afford to damage. In a startled or head-shaking dog, that same rigid swab can also puncture or perforate the eardrum outright. And eardrum perforation is a real veterinary emergency. It can cause significant pain, it can allow infection to spread into the middle ear, and depending on severity, it can result in partial or permanent hearing loss on that side. So here is your one-sentence rule. Stated plainly, never insert a cotton swab or any rigid object blindly into your dog's ear canal, because you cannot see what's at the bottom of that bend, and you cannot control the depth safely. Chapter 4 is the safe alternative, And the mechanism here is genuinely elegant because it works with your dog's own anatomy instead of fighting it. Instead of digging debris out, you flood it out. You fill the vertical part of the ear canal with a proper veterinary ear cleaner. Never water alone, since plain water doesn't break down waxy debris and can actually promote bacterial growth if it lingers. And then you gently massage the base of the ear, right where it meets the skull, for about 20 to 30 seconds. You'll actually hear a soft squelching sound as the massage works the cleaner down into that L-bend, breaking up compacted wax and debris and mixing it into a loosened liquid slurry. Then you let go and step back, because the single safest, most effective tool for finishing the job is a mechanism your dog already has built in: the head shake. That vigorous shake flings the loosened debris and excess liquid up and out through the vertical canal, using centrifugal force to clear material your fingers or a swab never could reach safely. Afterward, simply wipe the visible outer part of the ear flap and canal opening with a soft cotton ball or gauze, never a swab, to catch what's been flung loose. Let's move into Chapter 5, the tiered home care approaches, starting with the mildest situations and building up. Tier 1 is for a dog with minimal odor, light wax, and only occasional head shaking. Here, a weekly preventive cleaning using a veterinary ceruminolytic ear cleaner, applied exactly as described above, is often enough to keep wax from accumulating to problematic levels, especially in floppy-eared breeds where airflow is naturally reduced. Tier 2 is for dogs with noticeably increased wax or a mild odor but no visible redness or pain response when you touch the ear. Here, increasing cleaning frequency to 2 to 3 times a week for about a week, using the same massage and shake method, can often help flush out a developing mild overgrowth before it becomes a true infection. If there's no improvement within about 5 to 7 days, that's your sign it's moved past what home cleaning alone can fix. Tier 3 is for dogs prone to recurrent moisture-related ear issues, particularly swimmers, dogs who splash in the water bowl, or breeds with heavy, low-hanging floppy ears that reduce natural airflow into the canal. After swimming or bathing, a drying agent applied to the ear canal can help evaporate residual moisture before yeast has a chance to establish itself, and this is genuinely more about prevention than treatment. For these dogs, I generally recommend building the drying step into the routine every single time water gets near the ears, not just when a problem is already brewing, because consistency is what actually lowers the baseline risk over months and years rather than any single application doing the work on its own. One safety caveat that matters here: if you ever see any redness, swelling, or if the ear is clearly painful to the touch, skip all cleaning entirely and move straight to a vet visit, because cleaning an already inflamed or ulcerated canal can be genuinely painful and can worsen the irritation. Now for Chapter 6, my personal favorite trick, the one I tell almost every dog owner with recurring ear issues. Plain white vinegar diluted with water, mixed roughly 1 part vinegar to 2 or 3 parts water, can be used as an occasional rinse specifically for its mild acidifying effect, which makes the ear canal environment less hospitable to yeast overgrowth. This is a real, well-documented supportive measure, not a cure, and it works best as prevention in ears that are already healthy but yeast-prone, not as treatment for an active infection. The mandatory caveat here is non-negotiable. Never use vinegar or any acidic solution on an ear with any visible redness, open sores, or broken skin, because an acidic solution on compromised or ulcerated tissue causes real, significant stinging pain, and it can delay healing rather than help it. This trick is for maintenance in a healthy ear, full stop. That brings us to Chapter 7, the safety boundary. And I want you to actually remember this list, because this is the part that protects your dog's hearing. Stop all home care and call your vet immediately if you see any of the following: a strong odor that persists or worsens despite a few days of gentle home cleaning, visible redness, swelling, or heat in the canal, discharge that's yellow, green, or bloody, rather than the typical brown waxy buildup, your dog yelping, pulling away, or becoming aggressive when you touch near the ear, a head tilt that doesn't resolve, loss of balance, or eyes flicking rapidly side to side, or any sign the ear canal itself is swollen nearly shut. These signs matter because they suggest either a true infection requiring prescription antibiotic or antifungal medication that only a vet can prescribe correctly after identifying the actual organism involved, or deeper structural involvement that requires an otoscope to properly visualize the eardrum, a tool designed specifically to see past that L-bend safely, which is something neither you nor I can do with the naked eye at home. In some chronic or severely inflamed cases, Dogs even need brief sedation for a proper, pain-free exam, which again is something only a veterinary team can safely provide. So let's bring it all together. Your dog's ears are built with a protective bend that unfortunately also traps moisture and wax, which is why regular, gentle, non-invasive checking matters so much. Skip the cotton swab entirely. Use a proper ear cleaner with the massage and shake method instead. Use the tiered approach based on what you're actually seeing, and reach for that diluted vinegar rinse only as prevention in a healthy ear, never as treatment for one that's already inflamed. None of this makes you paranoid or overprotective. Spending 2 minutes a week checking your dog's ears is exactly the kind of quiet, unglamorous care that prevents real suffering down the line. And knowing when to stop and call a vet isn't giving up. It's the smartest, most loving decision you can make for him. I want to hear from you in the comments. What does your dog's ear actually smell like when things start going sideways? That corn chip yeasty smell, or something sharper and sourer? I read every single comment, so tell me what you've noticed. And if your dog's a repeat offender for ear infections, I want to know that too. If this masterclass helped you understand what's actually going on inside your dog's ears, hit like and subscribe so more worried pet owners can find it before they reach for that cotton swab. I'm Dr. Ryan Scott. Stay safe, and I'll see you in the next one.